So what about turf toe, also known as osteoarthritis of the great toe, also known as hallux rigidus, also known as hallux limitus? This video will cover the typical rehab and expectations without surgery, and if PT doesn't work, it'll help you decide if great toe fusion is right for you. By the way, the technical name for the great toe joint is MTP number 1. So if you have pain here, and your toe is not on an angle like this, and although you may have a bump that is not actually a bunion, you may have great toe osteoarthritis. This is different than a bunion. Although with a bunion, you can most definitely have arthritis. So arthritis generally means deterioration and inflammation of the joint. If you've had an injury to this joint, or if you walk or run a lot, you may have developed hallux limitus or hallux rigidus. Hallux limitus means that you have arthritis in your great toe joint and you've lost some of your range of motion. Hallux rigidus is the next step in severity. It means that you have arthritis in your great toe joint and you have a severe loss of range of motion. It may not even move at all. There are some things that you can try before having surgery to see if you can avoid surgery. So let's start by reducing the inflammation in the joint by stopping the irritation that's causing it, and by use of ice, topical agents, medications, some delivered by iontophoresis, or by injection, or by mouth. And I'm going to address each one of these in turn. So let's start with the common medications. They decrease inflammation, NSAIDs. They can be by mouth or topical. Steroids. That can be done by electronic delivery by your PT, taken by mouth, by injection, or using topical creams. And then of course CBD, which is also topical or by mouth. Ice is surprisingly powerful. So if you haven't tried that, ice for 10 minutes after something irritating, or maybe just after the activity at the end of your day. Now, you can start helping yourself by stopping the reason why it hurts in the first place. Walking and allowing your toe to bend with every step can be akin to hitting your thumb with a hammer over and over and over. So stop it. How? By wearing a shoe that doesn't bend. This means that the shoe takes the hit and not your foot. So try bending your shoe with your hands. Try really hard because walking puts 3 times your body weight on the shoe. That means a minimum of 300 pounds. So try bending the shoe really, really hard. The stiffer the shoe, the less your toe will bend and the more protected it will be. If you love a shoe that's too flexible, you can still wear it if you put something like a spring plate in your shoe. This you can buy online. It's made of metal, plastic, or carbon graphite. It's slim, so it doesn't take up too much space. If your shoe touching your joint is painful, you can have a cobbler or shoe repairman make a blister or outpouching of the leather to give your painful joint more space. Now, I have to say that most physical therapists do not know what to do with this problem. But someone who specializes in foot and ankle, and of course all the PTs at BioMechanic PT would know what to do. Physical therapy for this problem would run like this. Start with moist heat to the great toe joint. This increases the circulation and flushes the toxins out. It's also preparation for ultrasound. Ultrasound is amazing at getting the fluid moving around. Just getting the toxins out of the area will make it feel better. Why are there toxins there, you ask? Because the area is inflamed. When an area is inflamed, it has a higher metabolic rate. So the cells are creating more toxins by trying to heal the area. This is also why an inflamed joint is often very warm to the touch. After the ultrasound, the therapist will massage the area. It's kind of for the same purpose, for moving the toxins out and the nutrients in. Now, laser can come at any point in the cycle. We use an infrared, non-visible laser because it affects the healing cascade in 10 different places. It can cut the healing time in half for both bone and soft tissue. Next, joint distraction or traction can also feel really good on this poor joint. A normal joint has space between the cartilage surfaces and fluid so that those two surfaces don't rub together too hard. In an arthritic joint or a stiff joint, the surfaces are too close together and they rub. I'm sure I don't have to tell you how bad it hurts when these two surfaces rub together too hard. If you're suffering from this, that is. Enough joint distraction on a regular basis can eventually get you more space in the joint. Exercise is not indicated for this problem. You do not want to unnecessarily move this joint. Finally, ice in tandem with delivery of a steroid, commonly known as dexamethasone sodium phosphate, or a non-steroid called Kenalog, can be delivered using electricity. This is the iontophoresis I talked about earlier. It takes about 20 minutes and is done at the same time as the ice. So the iontophoresis delivers the anti-inflammatory drug up to 3 centimeters deep and focally in the area without any side effects, except maybe a little skin irritation if your skin is sensitive. So, no scary side effects like when you have to take a steroid by mouth, and no painful needles. The Dex lasts about 2 days in your system. When the drug wears off, your pain may come back a little bit, but not as much as before. So then we treat it again. The ice helps hold the drug in the area longer, so your blood just won't flush it away. This regimen of physical therapy should be done every other day, or at a minimum twice a week. If you do physical therapy along with wearing stiff-soled shoes, you should be a happy camper. And maybe you won't need surgery. We will cover the rehab after surgery should you decide to go that route in another video. If you like this video, please subscribe to us on YouTube, check out our website, or like us on Facebook.